Nerve supplying the eyeball. Mnemonic. For nerve supplying the skeletal muscles of eyeball. LR6SO4. Reminder 3. Cranial nerve 3. Oculomotor nerve. Supplies most of the muscles of eyeball. Cranial nerve 4. Trochlear nerve. Supplies the superior oblique muscle. Oculomotor nerve supplies muscles of eyeball. Trochlear nerve supplies superior oblique muscle. Abducens nerve supplies lateral rectus muscle. Injury to cranial nerves and symptoms. Cranial nerve 6 injury, cranial nerve 4 injury, 3 injury, 6 injury, lateral rectus paralysis causing medial squint. 4 injury, patient tilts his head to contralateral side. Cranial nerve 3 injury, down and out eye with ptosis. Cranial nerve 3, down and out eye with ptosis. 6 injury, lateral rectus paralysis causing medial squint. Patient tilts his head to contralateral side. Eyeball muscles and their actions. Mnemonic. Sin. This means only superiors or intorters. Intorsion, inward rotation. Therefore, superior oblique muscle supplied by cranial nerve 6 and superior rectus, cranial nerve 3 are both intorters. Superior oblique and superior rectus are both intorters. Actions of various muscles. Superior rectus. Elevation, adduction, intorsion. Superior oblique. Depression, abduction, intorsion. Lateral rectus, abduction. Inferior oblique, abduction, extorsion. Medial rectus, adduction. Inferior rectus, adductor, extorsion. Actions of various muscles. Superior rectus, elevation, adduction, intorsion. Superior oblique, depression, abduction, intorsion. Superior oblique, depression, abduction, intorsion. Lateral rectus, abduction. Inferior oblique, abduction, extorsion. Medial rectus, adduction. Inferior rectus, adduction, extorsion. Superior oblique muscle. Superior oblique muscle is also known as copying muscle. This is because it helps in taking the eye down and out. Down and out. Superior oblique muscle. To check the superior oblique clinically, ask the patient to look at the tip of his or her nose. For looking at the tip of nose, the eye should be adducted and depressed. Adduction and depression in the eye is chiefly done by superior oblique muscle assisted by inferior rectus muscle. In case the superior oblique muscle is not working or in case cranial nerve 4 lesion, the patient develops the vertical diplopia while looking at the tip of nose or reading a book or while going downstairs. Inferior rectus, it is the weakest depressor in adducted position. It is more powerful depressor in abducted position. Therefore, in abducted position, depression is chiefly done by inferior rectus muscle, assisted by superior oblique muscle. Oculomotor nerve. Cranial nerve 3 nuclei are present at level of superior colliculus in midbrain. Edinger-Westphal nucleus. It is the parasympathetic component. It controls two smooth muscles of eyeball. Sphincter pupillae muscle, ciliaris muscle. Sphincter pupillae muscle for light reflex, ciliaris muscle for accommodation reflex. Oculomotor nucleus. It is a motor nucleus, somatic component. It controls the skeletal muscles of eyeball, except lateral rectus muscle and superior oblique muscle. Oculomotor nucleus. Medial rectus, inferior oblique, levator palpebrae superioris, superior rectus. Medial rectus, inferior oblique, levator palpebrae superioris, superior rectus. Lesions in cranial nerve 3. Ipsilateral, down and out eye. Because the lateral rectus and superior rectus muscles are unopposed. Ipsilateral ptosis. Levator palpebrae superioris muscle is compromised. Ipsilateral fixed dilated pupil, mydriasis. Because of loss of light and accommodation reflex, the sphincter pupillae muscle and ciliaris muscle are compromised, and the dilated muscle is unopposed. Ipsilateral down and out eye. Because the lateral rectus and superior rectus muscles are unopposed. Ipsilateral ptosis. Levator palpebrae muscle is compromised. Ipsilateral fixed dilated pupil. Because of loss of light and accommodation reflex, sphincter pupillae muscle and ciliaris muscle are compromised, and dilated pupillae muscle is unopposed. Cranial nerve 3 lesion అయితే ipsilateral down and out eye. Ipsilateral ptosis, ipsilateral fixed dilated pupil.